Hi guys, I'm Oscar. I'm a FY2 doctor currently in Pilgrim Hospital, and I'm really happy to have the chance today to present on communication skills dedicated for IMG together with my friend Natalie, who is also F2. Okay, so one of the reason that we want to deliver this, we designed this session is because we realize that a lot of us, because me and Natalie, we are both IMG as well, and at the start of our NHS journey, we wish that we had someone who told us what to look out for, had some tips about communication skills before we embark on the journey of becoming a doctor in the UK. So we hope this session will be helpful. We'll try our best to answer any questions at the end. But in the meantime, we'll try to share whatever thoughts or whatever tips that we have. We have like almost 2 years of experience working in the NHS. Okay. So why is it important? We believe effective communication is important for patient care, especially those where those come with limited English proficiency. So we back in our countries, we don't use English in our day-to-day conversation. We might not even use English when we are conversing with our patients. So I think we just need the extra push. We have the knowledge, but we just need the extra push. Just to be more mindful of how important is communication skills and how it can affect our patient. Especially when it comes to explaining diagnosis and treatment plan, I believe it's paramount. Like we have to be clear so that the patients can understand, the people that we're working can understand whatever plans that we want to do. And there are a few barriers to communication, of course. First of all, cultural difference. This is a big one. Language barrier and accent. What they are just among the few most common barriers for IMG in terms of communication skill. So we might not be familiar with the medical vocabulary here when we are talking with our colleagues. And patients sometimes reluctant to share information with us, because that there is still room of improvement for our communication skills. So communication skill roughly can be broken down into verbal and non-verbal communication skill. So I'm just going to be sharing some tips about verbal communications first. So there are a few points that I've put on the slide. So first of all, first impression counts. It's really important. Simple things like saying hello and goodbye to your patient, to your colleague, is an easy but important way of gaining someone's trust even before, initiating a conversation. Second, always give accurate information. When someone is given an inaccurate information or poor explanation, you can lose their trust. They can it can strike someone as you don't know what you're doing. You don't want to be labeled as confused or incompetent. So, when we don't give clear and accurate information, that can be the consequences. So if you're not sure about what you're talking about, you can always be upfront about it. Just tell them that, you can come back and you can get back to them later when you find out the answer. Just always try to give as accurate information as possible. Thirdly, you can use open questions. Give the person that you're conversing with the chance to talk rather than asking one word answer, like asking question that seek for one word answer, like yes or no. Things like say how are you, are you okay, give the person that you're talking to some chance to elaborate whatever they are going through or whatever illness they have, or even your colleague who has confusion, you want to discuss with them. Number four, repeating and rephrasing. So this is, I personally find, a very useful technique. So it can help clarify with your colleagues, for example, or your patients. Make sure they really understand what you're talking about so that you guys are on the same page. So I found this online actually, and I quite agree with it. So there's this principle or this trick called 7 C's of communication skill. So we can always try to stick to it, and so that we make sure our communication will be crystal clear. So things like clear, be really clear about your message. Try to make it simple, concise, which brings to our second point, concise. Stick to the point, keep it brief, concrete, always provide things that you are sure about, you're confident about. Correct. So I think it's quite similar. So always use things that fit your audience level of knowledge and check for error and coherent. Make sure your conversations are connected and relevant. I think some of us would have to do some English proficiency tests. So I believe coherence is one of the most important thing. So make sure that the person you're talking to can follow your train of thought, can follow the flow of conversation. And we also have complete. So make sure your information is complete and contains all the relevant information. Courteous. So use friendly, open, and honest communication. So that you can really connect with whoever you're talking to. So hopefully by applying all these principles, your communication will be more effective, improve the quality of interaction with whoever, patient, colleague, or whoever they come across in the UK. Okay. So non-verbal communication, the second part of it that I've mentioned. So I think this is what most people don't realize. I feel like most people downplay the importance of non-verbal communication skill because I believe as is equally important as verbal communication. Even though, I know communication is not always about what you say, but it's about what you're portraying yourself to be. Okay, so a few things, important things that we will be covering today. So things like body language, establish that eye contact, how you position yourself to face your patient. That effective body language can really create a sense of connection between, the patient with you, your colleague with you. They make sure they are heard, make sure they feel like you are listening to them. Okay, touch. This can be a bit controversial. Sometimes we are advised against, for example, if it's opposite gender, we do not want to overdo it. But let's say, today, you're in a very difficult situation. It has happened to me of, so many times, like patient is gonna be initiated or end of life care. Patient has not long to live, and the family members are devastated. Like things like hand holding or reassuring pets can be appropriate in this context, but of course I have to admit that you have to approach this aspect with care. You do not want to overdo it. You have to respect the boundaries between individuals. Thirdly, you have facial expression. If you want to be known as a friendly person, you want to give person an impression of a friendly, a welcoming person. For example, try to smile in a friendly manner. It can sort of reduce the anxiety of your patient, knowing that you are approachable, knowing that you are friendly, knowing they can share whatever they want to tell you, with you openly. So I think that is one of the habit that I feel like I've picked up when I first came to the UK, and it really helped me to build rapport with my patients. And of course, we cannot ignore, things like this is a very important topic, like British slang in medical setting. So at times we'll find ourselves confused. We might not understand what our colleagues are talking about, or even the patient will tell you something that you've never heard of in your life. And so we're just gonna go through them briefly. I know it's impossible to go to you suddenly become an expert in British slang in just by attending a session, a short session actually, not very long. And we but just to plant the idea, and hopefully you can pick up more and more of this kind of knowledge along the your experience. So basic things, you might in your daily conversation you might have things like block, mate, cheers, block, like things. This is just simple British slang that they use in their daily conversation. Things like regional differences. The same word can mean differently in different part of England, for example, chuff means pleased or proud in London, while it means annoyed and displeased in Manchester. Medical slang like donkey's years, it means a long time, and I believe not everyone knows that. I myself didn't fully understand it when I first came here. Or even abbreviation when you're reading the medical records, like things like URTI, it might be structured differently back in your country where you practice. Okay, and just small examples of how about other phrases that is used in conversation in the UK that you might not be familiar with. Things like nip out, pop out, just means that you want to leave, go out for a short time. Turn up, arrive, pick up means collect, run out of, you do not have any remaining of certain thing. Head off means you want to usually means you want to go somewhere. Uh just a few examples of the phrases that they can use that you might not know before coming here. Greeting, how you open a conversation by greeting is also a huge part in British culture, I believe. So I'm just going to give you some example. Okay. Okay. So these are quite the common ones that I could find online that I personally have encountered in practicing in the hospital. So just be aware of it, and I'm going to be showing you some examples in the next slide about how to answer them. And the one important thing I realize here, if the patient asks you how are you, or if anyone asks you how are you, they are not expecting, in general, they are not expecting a long answer in a normal context. It's just purely how they greet you. It's just the same as Spain. Home country, we just say, how hi and good morning, goodbye. It's just, the way of saying it. So some example of the answers to those greeting. Not you do not have to stick to this all the time. Like you do not have to follow like a textbook. You can answer whatever you want, but these are just some fine examples that I could find. I'm sorry. So the playback. Sorry. Play the second one. Okay, so knowing what people are expecting you to answer them back, it sort of helps. I guess it helps you to feel you're more fit in, and I believe it will boost your confidence, make you feel more prepared to have a conversation with a British person, with a British patient. Okay, sorry. Oh, okay. So I'm just going to show you an example of poor communication, which I can find online, and I found this really helpful. Uh, Not saying that this has happened in a hospital, but I can pick up points where I've seen in different people, including myself, where they've just came from outside, not the UK, and then this kind of things that can be improved to better optimize our communication. Okay, so I think this is quite a good example. I know it's a quite exaggerated example. A normal doctor wouldn't have all this in one conversation, but I think you could appreciate some of the elements that I'm trying to express, things like, having a really rushed conversation, not acknowledging the persons you're talking to, whatever they're saying, be insensitive and so many more. So that conversation was truly terrible. So but believe that, we can, by seeing all these example, what we can do is we can try to improve them. We might not might not be doing this, but unknowingly we might be doing some parts or some elements of it unknowingly. And I believe by realizing it that we can work to improve it. Okay. Sorry. Okay. So I'm gonna pass it down to my friend Natalie, who is also at F2. We are both in Pilgrim Hospital. We both currently F2. She will be talking to you about breaking bad news right now. Okay, here. So yeah.
Hi, I'm Natalie, one of the F2s. Thank you very much for joining our session, and I hope it'll be useful for all of the IMGs. And so feel free to stop us at any point of time if you have any questions, or you can leave it towards the end of the session. Okay, so my session would just be breaking bad news and what sort of approach that we use in breaking bad news. So my first slide would be the reasons that we find it challenging, especially for IMG, during breaking bad news. So these are a few factors that we find it relatable for us as an IMG. So I believe Oscar has briefly mentioned about language and cultural barriers, which is one of the commonest reason. And the second one would be communication style differences, lack of familiarity with healthcare system, and the last one would be varying levels of exposure and training in breaking bad news. So for us IMG, sometimes we may have limited exposure to the communication practices that we use in the UK. So the medical education system in our home country may have emphasized different aspects of communication or utilize different teaching methods. So sometimes we will have to adapt and learn new communication techniques. And I'm sure by time and with practices, things will get slightly easier. Okay, so moving on, I'm sure most of you guys will be aware of this spikes protocol. So it's basically an approach that we use while breaking bad news. So the first one, S, S stand for settings. So for settings, we want to make sure that we find an appropriate setting, ensure privacy, and allow sufficient time for the conversation. And also, if available, sometimes involving a supportive team member like nurse or one of your colleagues could also be beneficial. Okay. And the next one would be P, perception. So we want to find out how the patient perceives their condition, how well they understand, or even their concerns and expectations about the whole conversation that you're bringing patient into. So by asking open-ended questions and actively listening, we can actually gain insight into their perspective. Okay. And for the next one is I, invitation. So this is basically asking the permission to share information and also respect the patient's autonomy. So we usually ask them, would they be happy for us to break, um, the level of bad news to them? So would they want it to be very detailed or very superficially, or would they prefer having someone else with them throughout the session and that sort of thing? Okay. And for the next one, it will be K, which stands for knowledge and information. So this involves delivering relevant medical information clearly and honestly. So it's very important to use very simple, plain language, avoid medical jargon, just so that you could allow your patient to understand the information that you're conveying better. Okay, and moving on will be E. So E will be empathetic responses. And I believe this is one of the crucial steps as well. So it's very essential um, to acknowledge and address the patient's emotional response to the news. And by using empathetic responses, such as active listening, validation, expressing understanding, can actually provide a much needed support. Just like what my colleagues say, body language do matters very much, especially in situation like this. Okay. So the final step will be developing a strategy and summary. So this involves working with the patient to develop a plan, like discussing treatment options, involving them in decision making, and also summarizing the key points in addressing any remaining concerns or questions, which is vital for clarity and understanding. Okay. So here are a few examples that we could use when using empathetic statements in situation that can be quite challenging, like breaking bad news, um, or even in situation like your patient's angry. So just to demonstrate that you understand and is there to support them. Okay, so the first one, you could say, I can only imagine how difficult this news must be for you, and I'm so sorry to be sharing this with you, and it's never easy to hear. And I want you to know that I'm here for you, and we never did this together. And just a just a few examples that we could use in situation like this. Okay, and also, one tip is that avoid saying, I can understand what you're going through, because most of the time we don't. So it's best to avoid that sort of statement. And so, yeah, we're approaching the end of our session. I'm just gonna let you know a little tips and tricks about breaking bad news. So we would want to break the news in layers. So you don't want to break the news too abruptly. You want to give time for the patient to digest whatever that you're saying. So it's best to break it in layers. Okay, and the second one would be respond to patient's reactions. So most of the time, patient will be in denial, anger, they will be frustrated, and sometimes they might actually break down after you telling them the news. So it's best to actually acknowledge their reaction and give whatever support that's needed at that point of time. Okay, and the third one would be a good listener. Because as you know, body language meant a lot, especially in tough, challenging situation like that, just like what Oscar showed you in the video previously. So you will always want to be attentive, eye contact, have a good eye contact, and have a good voice control as well. Make sure you're not speaking to your patient in a very rough tone. Okay, and also you can actually show them that you're listening by nodding and also maintain a very good body posture. Um, so the fourth one would be do not interrupt. So when the patient is talking, we'll try not to interrupt them just so that they could express whatever they want to express. Okay. And also the last but not least, remember to pause. Okay. Just because you don't want to break the news too abruptly sometimes. So it's best to assess the situation, give yourself time to pause, and then respond if your patient um is in denial, anger, or if they need support. Okay, so I think this is our final slide. And if you have any other questions, feel free to, just shout out in the chat box or just unmute yourself. Okay, thank you.
Okay, so this is towards the end of the session. I'm going to put some feedback form links, so make sure you fill them out. It will be really, really helpful for us. And so I'm going to stop the recording now, and we can start the Q&A session in a bit.